Hello, welcome to Data Analytics Colloquium, and good morning to the Taiwan attendees and a guest, and good evening to the U.S. participants. Now we have a special guest. I should also say good morning to our special speaker, Professor Thomas Cotto. And today, Dr. Scotto is going to give a speech on vaccines. Before I do that, allow me to introduce another co-host, Dr. Peter Pan. He will talk about our colloquium. Peter, can you?
Yes, thank you, Carl.
All right.
So welcome to the Data Analytics Colloquium, and good morning, Professor Scotto and Professor Hope. Thank you and everyone who's online, and thank you for joining us on this colloquium. Let me just briefly introduce this colloquium to you all. Actually, this is an initiative that we try to pull get things people together, and we're focusing on the data analytics in the field of public policy and public administration and political science. So I think this is a really a great opportunity, and then we launched this colloquium, especially during the past year, and we know this pandemic. And this is bringing this opportunity to us, so people are getting used to an online form of meeting. So we started to invite very distinguished scholars, such as what we have here today, Professor Scotto. And previously, we have invited a few from the United States, including the Chris Aiken from the Princeton University, and Dr. Also Kusuke Imai from Harvard University, and also Harold Clark from University of Texas at Dallas. And also they're coming up events. We invite people from scholars from Texas A&M, Professor Guy Witten, and also the American University, Jeff Field. So I consider this a promotion and as an ad. I just want to say that this is a great opportunity, and that this is a great place to meet those specialists and distinguished scholars. So please stay tuned and remember to come back and share whatever you have, the ideas, and then we can exchange all the ideas on this platform. And this is why we initiate this platform or this colloquium for. So back to today's topics. I just want to thank Professor Thomas Scotto again from Scotland. And this is really, we crossed the Atlantic, and now we have the guests from Europe. So this is very exciting. So why don't we just turn the microphone to Carl and let him just introduce today's special guest. Thank you.
All right. Thank you. Thank you, Peter. I think we're really privileged to have this colloquium, particularly with so many guests and the honorable guests, and also the top-notch scholars. Today, I want to introduce to you Professor Thomas Scotto. Tom is a prolific scholar, and currently he holds the position as Dean of Learning and Teaching at the University of Glasgow, responsible for a college for over 10,000 students, and in terms of teaching, learning, all the system in that area. And he is also really active in research. His research is focused on public opinion, comparative public opinion, and also famous for his works in foreign policy influence on public policy. And his works appears in multiple journals, Personality and Individual Differences, and also the Australian Journal of International Affairs. Tonight, Dr. Scotto is going to deliver a speech. Now we have a new title. It's called Profiling profiles in vaccine skepticism. Without further ado, allow me to introduce Professor Thomas Scotto.
Thank you. Thank you very much. It's very, very nice to be here this morning. So, I'm really passionate about, empirical methods and teaching empirical methods from an applied perspective. It's really exciting to see an audience that are interested, and I think that some of the best ways of getting people excited about this work is not to go over the math and not to bore people with models, but to really apply it to a modern problem, okay, that we're having in the world. Before I get started, can I see through raise of hands of the audience how many people have heard of a technique called factor analysis? I just want to figure out how to make sure I know how to pitch this. Can you raise your hand if you've heard of factor analysis from the audience? Okay, 2 people. Okay. Latent profile analysis. Oh, one other person too. Okay. So I think what I'll do is I'll take this nice and slow. Okay, we'll Carl has some of the outputs to upload, but I'll go over how I think about these problems and so forth. So I'm a voting behavior guy by I guess by history. But what that has given me is the ability to analyze survey data, like, what makes for a good question and what makes for a bad question, so to speak. So we've been talking about with our National Health Service, okay, when you're actually talking, okay, about how when a vaccine becomes available, the UK government is reluctant to pass a law. You have a public policy problem mandating that people get vaccines, okay, so you can force people, okay, under penalty of fine or something like that. And the UK government says, well, that's really culturally, that's unacceptable. There'll be too much of a backlash, okay? So last week in the UK, and I assume the news has come down to Taiwan and the United States, obviously, is that the vaccine process seems to be doing well. We got a lot of good news, about that there's a high likelihood that there'll be at least a vaccine that will be trialed. The challenge is that due to a very famous article that was published and wrongly published in a medical journal that linked vaccines to autism, okay, childhood vaccination to autism, and rumors that have gone around about vaccines, that there's an element of the public, okay, that is very skeptical of taking vaccines. They believe that it could cause harm. It can create problems in children, and then there's other people that say, well, I'm kind of okay with vaccines, but why should I have to take it when everybody else is? So you have what's called in social science a free rider problem, right? And so forth. So what we have to do is we have to think of how we message this, okay, and how you create public health messaging in the United States and the United Kingdom is highly dependent upon your audience, okay, in terms of doctors and medical scientists often think of, well, we'll just give them the facts, right? We'll just say what the vaccine does. We'll say what it is. And a lot of us are saying, well, maybe that's not the best public health message, particularly with traditional vaccines. The new vaccine may not be like this, but traditional vaccines is you're injecting people with a needle with dead virus, okay? And many people find that really, really not good. So you have to really think about how you want to message this, okay? And the challenge is that different people may be more prone to accept certain messages while other people, may need different messages, okay? It's sort of heterogeneous, what we call heterogeneous populations. A lot of times in surveys, we think of entire groups of Americans, groups of Taiwanese, groups of British, as a single population, as a single group, whereas reality is that they break down, okay? And if you go back, if you like the American elections, or if you hate the American elections but can't keep your mind off of the American elections, these mistakes were made. Okay, many people thought, for example, Latino Americans were one type of a group, and then they voted in very different ways. It's because people really didn't understand that underlying this group of people called, Latinos in the United States, basically that there were many groups, there were many subgroups. Okay, how do you figure this out? Okay, through a survey. And that's what I'm really like. How do you take a bunch of questions and try to look at the population, okay, and say, well, wait a minute, can we divide this population, even though we don't have a good idea of how they do? Okay, and that gets into what's called latent variable modeling. Okay, sometimes called structural equation modeling. Okay, in the statistical literature. Okay, and we're doing this. This is a lot of methods, but we're doing this largely to inform a public policy and a public health debate. So we've been asked, I think, by people in the healthcare sector to really think about, how people divide in terms of vaccine research. Okay, so we need to understand what's going on here. Okay. Traditionally, when you have a group of questions, okay, when you're designing surveys, okay, if you're designing, and many of you may be asked to that as a part of a dissertation project, or maybe you're going to work with one of the ministries after you graduate from university, get your degree and so forth. Okay, sometimes it's very difficult to ask just one question and feel like you fully have the concepts, okay, at hand. So when you're designing surveys, a lot of times what you want to do is ask a number of questions, okay, on a concept, okay. So much like you would take an intelligence test, like from a psychologist, okay, where they wouldn't just give you one test. If you've ever taken an IQ test, they've given you, this test, and you take a break for 5 minutes, and you get this test, and you get another part of the test, okay. And what that is people have this idea that there's this unknown variable out there, and it's often called a latent variable, okay, and it's unobserved, it reflects how you answer, how you score on each of the IQ batteries, okay, but it also can reflect how you answer each of the survey questions, okay. But it's hypothetical, right? It's social science. I have to actually think about this, okay. I have this idea that if I ask a bunch of questions that I formulate very well, okay, on about people's attitudes towards vaccines, okay, I'm going to get an overall kind of measure. Okay, the math is a little complicated, but we don't really need to deal with that tonight. I can give you textbooks and stuff if you really want to know the background to that. But there's this underlying measure of vaccine skepticism, okay, in the question, okay. And sometimes what we do initially is we want to see which questions, particularly where we don't have this very well developed. If you're Carl or Harold Clark or some of the colleagues here, they know they've been doing voting behavior surveys for years. So those questions don't change all that much. Maybe you change the candidate name and so forth and so on, but you don't necessarily do much. These are new questions that we've been asked to do by the health authority to try to figure out how to measure people's vaccine skepticism. Okay, so and one way of doing this is through a technique called factor analysis. Okay, you have an underlying latent variable. Okay. And you hypothesize that the relationship between this latent variable, all the factor analysis is, and what you observe, the answers to the 8 or 10 survey questions are going to be strong. Okay, and if they're not, then you have an idea that maybe you haven't asked the right questions. Okay, that's simplifying things, but I think that's what we want to know for the purposes of tonight's question. Okay. And one of the things we want to know also, what latent variable modeling can tell us, is much like other statistical models, right? You want to know, well, is this a concept of itself, or is vaccine skepticism part of an overall worldview, okay, an overall view to the people, which is an interesting question. I think it's an interesting social science question, particularly because in the Western sort of in the United States and the United Kingdom, people who are skeptical about vaccines are not just of the political left or just of the political right. You have people on both the left and the right ideologically that are skeptical. Okay, on the left, they generally are these people just the same. Okay, that people that don't like genetically modified foods, for example. Okay, on the right are these people who don't want, who find government telling them what to do and so forth very invasive, and feel that this is against their civil liberties and so forth. So you have a very different, okay, and what factor analysis can do is to tell us whether or not these are distinct concepts or not. Okay, you would ask another battery of questions on, let's say, genetically modified foods, and you'd see, well, do they just load under the same latent variable, or are they different? So the correlates there. Okay. What a factor analysis assumes, though, okay, and why this is probably not where we want to go here, is a factor analysis of a latent variable assumes that there's an underlying continuous trend. You range from very low to vaccine skepticism to very high on vaccine skepticism, that it's a continuum, okay? And in medical science, dealing with a continuum sometimes can be very difficult, because what you want to do is cut people off and group people. Okay, so when you're dealing with a continuum, okay, it's a continuous line, right? You need to make decisions as to where to split people off. Okay, and how people do that, okay, sometimes can be very crude. Okay, so medical science likes, instead of using a factor analysis, okay, they like what's called a latent class or a latent profile analysis. Okay? It's the same idea, okay, in that there's an underlying variable. Okay, there's an underlying latent variable that causes response to survey questions, whether it be voting or whether it be on vaccines. Okay, but instead of being a continuous variable, it's a categorical variable or a nominal variable. Okay, you're either in this group or not, or you're in another group, and you specify based upon either both theory and empirical findings how many groups that there are. Okay, and what we're looking for then is not just a range, right, ranging from very low to medium to high, okay, but rather people who might be skeptical, okay, people who score low on, let's say, all of the variables, people that are very supportive, okay, and then maybe there are people in the middle, but maybe they're in the middle because they answer some questions really well, or really high with a lot of skepticism, and some questions really low with a little bit of skepticism. So I want to take you forward, okay, towards how I begin to think about a problem that's been sort of given to me by our healthcare situation and what we're dealing with. Okay, so factor analysis is concerned with how variables relate to one another. Okay, and the latent profile analysis tries to take your data, okay, and say, okay, this person, respondent 1, is in all likelihood in class 3. Respondent 2 is in all likelihood in class number 2. Okay, and then it's up to you. It's as much of an art as it is a science. Okay, and how confident can we be that we group these people? And once we have these groups, then we can put this stuff back into the data set and say, well, wait a minute, we can do sort of experiments, which is another aspect of social science that you might have other talks on later, right? And if I know someone is in the vaccine skeptic group, does that mean they're going to listen to a message, or are they just going to reject any message I try to send them? Okay, so if we don't do this, okay, if we don't go through it, if we just assume a population is what we call homogeneous, or just of one group, or just sits along a very simple continuum, you may miss the nuance, and we may miss the need to tailor public health messages to different groups depending on how they sort of respond to vaccines as a whole. What is their latent underlying preference and fear of vaccines going into this where we may need to convince to finally rid ourselves of this of this plague, we may need to convince ourselves a good deal of doing that. Okay, and then we can actually look and compare, right? Does the United States and the United Kingdom have the same types of profiles or the same types of people? Are the sizes of the groups bigger or smaller? So that's what I'm going to be looking at in the sort of methodological exercise I take you through in terms of this thing. Are there any questions? I think I'll just pause. Please raise your hand if you have any concerns. If I'm going too quickly, I realize this. It's of different time. It's late in the day for some. It's really early for others. The language might not be easy. So please just stop me. I'm happy to go over anything you may have. Okay. Okay, so where did my first screen go? Okay. So what we have is, long before this, why the National Health Service is interested is long before we had this plague. In an earlier survey, we talked to the United States, and we talked to residents in the United States and the United Kingdom at slightly different times, but not that much different, just a year apart. And we asked them a series of questions on vaccines. Now, Carl, I think I've asked, do you want me to pull those up, or will students have those? Would it be easier for me to pull those?
Yeah, either way, and I send it. It's available at our GitHub. I send you the link. You can directly download this PDF file. Dr. Scotto disseminated earlier. So, to our GitHub, you can download it, and you can check on your conversation box, and you can get a copy of this. And all the materials. A quick reminder will be available in the repository under the name of the speaker. And for example, in this case, it's a Scotto repository. All the materials will be loaded there. You can come back and then want to check out the slides, etc. You can go to the same link to get the materials.
So these are what we asked people. Okay, so getting vaccines is a good way to protect children from diseases. Okay, and we asked basically a standard survey question: do you agree or disagree with this? And what you're seeing is we're reading across here. This is each of the countries. They were separate samples, okay, at separate times. Okay, and you get this idea of agreement, and largely people are believe that that's good for children. The vaccines are good. That's not a bad thing. Okay. But then you sort of see, well, do people actually play by the rules, right? I do what my doctor, I listen to my doctor, I trust my doctor. Well, there you get a little bit more, people are less intense, right, about this, okay? And there's a little bit of worry, particularly a little bit more in the United States, among a certain a certain minority of the sample, that they disagree with this idea that that people are giving them the right advice. And if you listen to the heated rhetoric in the United States, which probably sounds incredibly silly to anyone in Taiwan, about masks and about people listening and doing what they're told, and the politicization, right? You start worrying about these, okay? These are what we call positively worded questions, where agree is agreeing, like with the vaccine. You basically agree that vaccines are agreement is the pro-vaccine side. But in any good battery, a lot of times what you want to do is you want a mix of positive and negatively worded questions. So once we get down here, okay, we said, well, enough children are vaccinated that even unvaccinated children are safe from disease, okay? And luckily, okay, we see very few people agree with that, right? Because that's what you would expect. You would expect the question to be flipped and reversed, because what you don't want, and we're trying to actually, make sure people are reading the questions properly, okay? But you get people though, that are they're worried about side effects, right? So what we're trying to do is get a good overall feeling of how, what do people really believe about vaccines, and is there an underlying, is there an underlying trait? Okay, and that's basically how we how we how we do it. Now, we could, okay, students often, I think often, when you're comparing countries the way we're doing it here, um, we could just do on each of the questions what's called a chi-square test and say, well, is the distribution of responses separate or the same among the British and the Americans? Okay, and I can tell you all the chi-squares here are significant, so there are differences. But what does that really say about US UK comparisons? Okay, a lot of times when people are comparing survey responses across countries, they are usually doing it with one or two questions, and from a measurement perspective, that's really dangerous, right? It's sometimes because you're assuming that people respond in a similar fashion to each of the questions, where a lot of times when you want to compare across countries, you want a good battery, so you're making sure you're not comparing apples to oranges, so to speak. If you eyeball it, I think one of the bigger things we see is that the Brits tend to often be a bit more in agreement on some of these questions, or in the pro-vaccine direction, but their intensity is not as as strong. They agree or they disagree. They don't necessarily strongly disagree or strongly agree. There are differences within this, and sometimes we see this in a lot of surveys, depending on that could be a cultural thing, that Americans are, rah rah, they're much more likely to ask at the extremes, and we need techniques for actually, trying to suss that out if we're going to compare across countries, and you can't really do that with just one survey question across nations. So it gives you an idea of why you ask batteries of questions for this. Okay. So that's kind of that.
没关系，
Okay. I'm sorry?
下可能可以想想看有什么可以讨论的。
哎呦，还真的没想。
我想一想。
Did somebody have a question? Or is somebody just forgetting to mute the mic?
Let me unmute. Let me mute everyone, and in case accidentally unmute themselves.
If you have a question, please let me know. I'm happy to start. So, okay. So what I did was I went into Stata or whatever statistical program that you used, and I coded the questions. Okay, so that each that higher scores, lower scores, being anti-vaccine or skeptical of vaccines, was coded strongly disagree, like in question 1, was coded 1, 2, 3, 4, 5, right? So agree. And then in the questions that were flipped, I did the opposite. Okay, so higher codes on the variables mean that you're more willing to take a vaccine, you're open to vaccines, you believe vaccines are safe, you believe, all of that stuff, because we want everything pointing sort of in one direction for that. Okay. And then what I did was I cleaned the data and I put it into a program called M+, which is what I use for structural equation modeling. Now, there are a lot of programs for this. R has its own package. I'm old, so I haven't bothered to learn but R will do. R has a couple of SEM packages for it. Okay, so what you do is where did it go? CFA to Carl. There we go. Okay, so what this looks like, I think it's first important to visualize this. Don't worry about the numbers so much yet. Okay, but these are my questions. Okay, we call these, these are the 10 questions that I asked, much like you saw on that outline. Okay, and then what I'm hypothesizing, okay, is that there's this variable, okay, that we don't really observe, much like your IQ or your intelligence or something, and it causes responses to these questions. Okay, so the hypothesis are that these questions basically go together. They correlate well enough with one another that they have something in common called vaccine skepticism. That's all a factor analysis really is in sort of plain, common everyday language. Okay, if we're looking at that. Okay, so before we see all the numbers, think of this as the chart. Okay, so then if we were to look at this, where'd it go? Okay, so let's take a look first at the United States. Okay, so if we looked at this, again, these are the counts, much like you saw from the percentages. Okay, in terms of what you'd see. Okay, and then it runs. Okay, it shows you what you're doing, and basically what it's showing you is this is the relationship, okay, between, much like a regression coefficient. Okay, it's a little bit different, but it's not, or it's technically an ordered probit.
Hi Tom, is it possible? Is it possible to explore a little bit the font?
Oh,
Make
I'm
the larger?
sorry. Yeah, is it just coming
Yeah,
out
that's
as too
okay.
small?
Yeah, yeah, a little bit bigger, that'd be great. And students maybe seeing this, maybe for my old aging eyes, and I need to. You can zoom in. I think maybe we zoom in a little bit. Can you under view?
View.
Under view, yeah, zoom in. Oh, not.
Bum.
It's not an option. That's okay. Don't worry about it then.
You know what I can do? I can do this easier. I can just do it like this. Do that. Do that.
Yeah, that's nice. Yeah.
And then
yes, you can blow it up and
for your new. Will that work?
landscape then. That's of course this is good. This is good. Thank you. Yeah.
Got it. Let's see if this will work. It's a little bit hard, but we'll see. Okay, don't worry about that. That's just all of the. They like output. M+ loves output. Okay, that's just the methods. That's just what I showed you effectively. These are the percentages that you would see from the table. Okay, and then we'll get to this in a minute. Yeah, this is the problem is, can I do landscape? Where do I switch to landscape orientation? Let's see if it'll allow me. Yeah, there we go. That's much better. Oh, results. Okay. So what they're saying is, now on the surface, this looks pretty strong. That actually, these are what's called factor loadings. Okay, and these are standard errors. It's a little nicer on the M+ output, but we're just sort of doing this. And those are Z scores or T scores, depending. So basically, there's a relationship, okay, between the factor, okay, and all of these questions. Not surprisingly, because they all mention vaccines and they all mention, that sort of stuff. Okay, so there's basically evidence, okay, that you would basically have an underlying factor. The challenge is to judge a fact. That's one way of judging a factor analysis. The other way is basically what they call the root mean squared error. Okay, is the relationship is how much, let's say there's an overlying correlation matrix, and then there's a model, okay, of that correlation that the factor does, and how much does the model miss. And generally, when you're judging factor models, okay, we can get technical if people have a question, but you want this to be definitely under 0.001, okay? So there's a hint there, okay, that my model may not be working as well as I would like it to be, okay? Well, why is this, okay? I did a bit more work, and ideally, okay, I looked and I said, well, all of the misfit, and this I think we don't have a lot of time. I'm happy to take people through it in the Q&A, but a lot of the misfit is coming from confusion people have over the negative question wordings. Okay, so ideally, when you're designing survey batteries, you should have positive and negative question wordings. That's a good thing. But, people get tired, and if they're doing online surveys, they're clicking through this stuff pretty quickly. And what the factor analysis is picking up is this amount of mismeasurement. Okay, so then I ran a second model, which is very similar, but, and these are all in the, Carl, these are all in the output folder. Okay, so the VAX items out, and the USA 1 that's the single factor, okay? But what I did then in the second time is, where did it go? I think it's easier to visualize and show you the, that's why I made these graphs. Here we go. So I created a second factor, okay? And I said, what I want to do here is I want to basically say all of those negative worded questions, part of the response is not caused by the substantive, people's true attitudes towards vaccines. They're actually caused by the fact that they're misreading a question, okay, as strongly agree. They say, oh, well, the first question said, I'm pro-vaccine, and I am pro-vaccine, so I'm going to answer agree to all of them and not really read them, okay? And people do this on surveys. So it's sort of what we would call a forensic analysis of survey questions and how people actually, how people look at this, this stuff, okay? So I ran this, and if you look, I won't get into this specifically because I know there's time for questions and answers. We want time for questions and answers, but basically you get a fitting model. Okay, you get a model that effectively, once you account for this error, but that tells me something, that if I'm going to deploy this for the NHS, I've got to be really careful about what I ask. Okay, and so to try to break people into groups, what I did was I said, well, I'm going to discard all of the questions asked one way, and I'm just going to focus on the negatively worded questions. So they're all in one direction. Okay. So the second thing I did, the other thing I did, I won't go into this, Carl, but again, if we want to come back to this, is I compared American responses to the British responses, and found that actually they're not that much different. The overall level of vaccine skepticism, once you account for all of this measurement stuff, there really aren't very large differences among how the British feel on average and how the Americans feel about vaccines overall. Okay. So getting back to where where was I? Presentation. Okay. So we did that. Okay. So like I said, let me just widen my screen there. Get in there. I don't want to give control. What do I want to do? So many buttons, Carl. There he is. Can people see that? Okay.
Yes.
So the folder, all of the statistical outputs I've given to you, and I guess you'll put that on GitHub. Okay. But what we now have to do is come up with a profile, okay, or a class or a profile of vaccines, okay, in terms of how to judge this. Okay. So instead of assuming that the underlying variable is continuous, what a latent class analysis does is said that there are underlying categories that cause people to respond to questions, to survey questions in certain ways. Okay. So that there are underlying groups of people. Okay. And the benefit of a latent class analysis is we don't yet have to say, well, these must be the women or these must be the men, or no. It's basically as a response, it analyzes the statistical procedure. What it does is it analyzes and it looks for underlying or latent groups, right? Groups that you wouldn't immediately see, but groups that you can see, groups that come out of the statistical analysis. And then you can do further analyses on these types of responses. Okay, so what I did then was I reran, okay, and I went to Carl, and that's in the latent profile, okay. And what you do, okay, is you as the investigator, okay, have to basically judge how many groups you want. Okay, there's no nobody's going to come knock on your door and tell you, well, there are 3 groups in the population, right? And there are ways of doing this through what they call the Bayesian information criterion, right? One of the ways of looking at this is an underlying group. The second is looking how confident you are. The S will give you a confidence level in terms of how well how confident you are that a person's in one group versus another. Okay, so I started this latent profile analysis, okay, with 3 groups, okay, I started with 3, but let's do the 4 group analysis. Let's see, can I zoom this? Let's do the same sort of thing we did for last time. I'm sorry, I would have provided better handouts, Carl. I didn't realize that this would.
Don't worry. I think it's fine.
Okay. Let's do it. Okay. Yeah, this is it. Get rid of this. Okay. So what you have here is what the procedure does is it actually says, okay, we've got all these questions. I only remember for this one, I only use the negatively worded questions. Keep going. It really loves its output. And as you get more into this, you'll have to figure out what all of these mean. This is sort of just a taster. In terms of that. So there's things to look for when you're doing this. What it does is it divides your data, okay, into groups, okay. And now what I fed into the machine is I said I wanted 4 classes. I wanted to check how well the model would do with 4 classes. And it said, okay, Tom, you took these negatively worded questions, 4 through 9. You took 5 or 6 questions in there, and you created one group with 32% of the population, right? Okay, it said of the 4,000 or 5,000 respondents you had in there, 12,000 it estimates, or 1,200, sorry, a little over 1,200 or 32% it estimates in class 1. 44% in class 2 or 45%, and then you have 2 smaller classes, okay? And well, what are these groups, okay? Well, based upon the responses that you give, each of these, if we go down to 1, these are logit coefficients. We definitely don't want to play with that at 2 in the morning. So we will go into probabilities. Okay. So remember, these are what they call categorical variables. So people can respond category 1, which in our case is the most skeptical, to category 5, which is the most supportive of the vaccine. Okay. So vaccine 4, there is this question. Okay, 1, 2, 3, 4. Say children do not need vaccines, okay, for diseases that are not common anymore, okay. So if you answered this question, okay, and this means that you strongly agreed, you said, well, vaccines really aren't necessary for children, so you're a vaccine skeptic, basically, Okay, so what latent class 1 is saying is the people in latent class 1, okay, they were very unlikely to answer in category 1, category 2, category 3, or category 4. There's more of them. These are people that generally agree with this, that disagree with that question. They're pro-vaccine, okay? They're also, on vaccine 5, they're pro-vaccine. On vaccine, on the 6th question or the 7th question, they're also pro-vaccine, okay? And what are you sort of merging, okay? So with this group that has, 30-something% in there, okay, we start getting that group 1 looks like a group that's kind of very supportive of vaccines, okay, latent class 1. Okay, so for now, let's call them, and again, you can't, you have to name them, unfortunately. The computer will give you the statistical output, but it's an art more than a science, okay, is we're going to call these people the pro-vaccines, okay? And what did we say? We said it was about, 30-something%, Coral? I forget what I just left.
I saw it like 44, yeah.
Okay.
43.
So, but then you have to look at, this is then latent class 2, okay? And then we look at their responses, okay? And this is a group that's kind of interesting because across the board, they're very much in the medium agree, okay? So what we're looking at are two groups of people in Britain that are basically the majority, okay, an overwhelming majority, that are mostly agreeing with vaccines. Okay, because they're a little bit different. This group is much more in the agree, whereas the group before was in the strongly agree. Okay, and the public health implications of that, the policy implications, well, these might be your opinion leaders in class 1. Okay, that you get to maybe convince their friends and talk to groups about vaccines if we're trying a public health information, because so there's policy relevant advice I can give. Whereas group 2 will go along, okay? Group 3 then, okay, is a little bit different, okay? Whereas if you started to look at the questions above, sorry, this isn't as clear. They were very unlikely. People in classes 1 and 2 were very unlikely to be to be vaccine skeptic. You're starting to get more and more people here in the lower categories. Okay, right. So these people are, low normal, I would say. You still get a couple of times they're willing to answer, yeah, kind of kids are okay having vaccines, but there's more and more in this 5th group, okay, that are a 3rd group, I'm sorry, that are skeptical. Okay, so we'll call these people mostly skeptic, okay, and then finally, your last group is category 4. Okay, and these are the people that basically answer the middle category. They neither agree nor disagree. Okay, and what we call those is they're my ambivalent people. They're not really against vaccines, but they're not really going to go out and get go out of their way. Right? You talk to me, the minute a COVID vaccine comes, I'm in the doctor's office. These people, they'll take a lot of convincing in a public health information campaign. Okay, so that's that's kind of what we're looking at. Okay, now a latent class analysis with 5 categories in survey data is a bit messy. Okay, what you can do is relax this a bit, Carl, and go to what's called a latent profile analysis. Okay, and what a latent profile analysis does is it assumes all of the survey questions are continuous, right? So we have a variable that's measured 1 to 5, and in each of the classes, each of the variables is going to get an average. They're going to be an average. So what I did here is I did a profile analysis for Britain. Okay, so you can't see that. That's too small, Carl.
That's fine. I think it's readable. Yeah, thank you. It's legible. Thank you.
Okay, this is okay. Okay, so this assumes continuity. Okay. And with 5 classes, okay, I was trying, I'll be honest, I was trying to get a class that was very clearly skeptic. In Britain, I wanted to know who are my people that are going to be really against vaccines, the anti-vaxxers, so to speak, okay? And I think I kind of got it here. So if you extend this, if you do make 2 changes to the analysis here, you basically get one, you go from 4 to 5, okay? And there's something called, you might not be able to see the exact number, called the sample size adjusted BIC, okay, which is a way of adjudicating. You want that statistic to get lower and lower, okay? If it doesn't get lower, then it's not good going to another class. You're not gaining anything in sort of plain English. But what we really are interested in is when we relax the assumptions of categorical and we add one more class, we get 5 classes, one with 6%, one with 17%, one with 28%, a similar one with 29%, and one with 20%. Okay. Now, what does that look like? Okay. What these are these are averages. Okay. Instead of categories now, we're looking at averages. Okay. So what this is saying is that in class 1, okay, this very small class, okay, on a score of 1 to 5, these are the averages across each of the variables. And what do we see with this group of 6%? That is 6% of the British population. Well, they're scoring quite low. Okay, they're really low here, right? They're in the disagree with pro-vaccine, between disagree and strongly disagree on average with the pro-vaccines, or agree or strongly agree with the reverse worded questions. Okay, so these are clearly my skeptics. So I've got it, right? And that's what I really wanted out of this analysis. I wanted to be able to identify and uncover. Okay, so I'm going to call these people my skeptics. Okay. Then class 2, again, remember this, it's on a scale. So 3 is the midpoint. These are kind of my medium people, right? This is 17% of the population. Okay, these are kind of medium. Class 3 is kind of very similar, but it's a little higher, right? These people do a little bit better. So I would say the second class I would call medium low. The third class I would say medium high. Now these are my friends, okay? Because these people on a scale of 1 to 5, on many of the questions, they're between 4 and 5. These are my pro-vaccines, okay? As a matter of fact, you could see by this ridiculous standard error here, or this ridiculous t-score, and on a scale of 1 to 5, it averages 4.99, okay? So on question 9, they basically say, they disagree. They strongly disagree that the risks of vaccinations posed to children outweigh the benefits. They're saying go get vaccinated, okay? So what you're identifying through this process is 30% or 29% of Britain are going to be your opinion leaders, right? How are we going to reach them and get them to convince, their friends, their family to go out and get vaccines? Like class 4 is the public health expert's friend, right? Whereas, now it might be that class 1 with all of these the 6%, you might never get them, right? From a public health perspective, those people are probably really, really fearful of vaccines and probably aren't going to get vaccinated. Now, the good news is it's 6%, and most models of herd immunity say we can afford that. What we can't afford, if we're taking the science seriously, are these types of people who are ambivalent, not getting vaccinated. Right? So you start to think of a narrative, you start to think of a conversation of, okay, how are we going to identify people? Okay, these people, Do I really want to worry about them with, let's say I have, I don't know, 100 million, the NHS gives me 100 million pounds to do a public health campaign, right? These people I'm probably not reaching. Reassuring that it's only 6% of the population. These people, okay, are these people I might want to think of the questions I've asked, and I might want to move now from experiments, or move from just sort of cross-sectional survey analysis to experiments, right? What kind of messaging will these people listen to, right? What will they be convinced? What will tell them that, yes, I want to go out and get vaccinated, or yes, that vaccines are safe, right? Because where are they at? They're most skeptical of questions 6 and 8. Okay. Interestingly, ready? The question that they're most skeptical of is a question that says, enough children are vaccinated that even unvaccinated children are safe from disease. What is that saying? Well, these are the people that probably are more likely, or just barely willing to go along with this idea that, well, if everybody else gets it, then I don't need my children. And there might be something a little fuzzy, particularly early on in the vaccination. I think we'll wait, right? Or I think, I might get it eventually, but I'm going to wait a couple of years. Okay. Now, in this crisis, granted, we're not going to vaccinate everybody in the first. We may be one of the benefits of not having the quick rollout. If the NHS says, well, you don't want it now, there's going to be hundreds of people waiting, and children aren't going to be at least in the UK, the policy will probably be that children aren't going to be vaccinated. But you've got to think of these messages. Okay, so that is kind of how I'm using my research. You wanted me to sort of open it up for questions after, we're about an hour in. I can talk a little bit more, or I've pulled these back into Stata. We can take a look at how these things actually relate to political views and things like that, right? So what you want is you want to get are young people, or are women more likely to be in the pro-vaccination? So you target groups. Women generally make a lot of healthcare decisions for the children in the household. Patriarchal society that the United Kingdom and the United States kind of are. I think that's still generally. So so you start to get an idea of, well, here's how you use this for public policy purposes. It's a very applied talk compared to some of the academic gobbledygook that I do, actually. So I think I'll pause at least and see if people want to ask questions or have concerns, or.
Yeah, I think this is a very informative research. I think, and also of very high relevance at this point. Now we are still in the depth of pandemic in Texas. I don't know about Glasgow or in UK. I heard that Europe
we
is
are on
still
stage 4
doing
lockdown, which means
so
I
we
will
have
not
some
be leaving
states.
my house for a long time.
So I am imprisoned in my house for a long time too, and but basically this is my world, my window. My immediate question is, now this research is not just for academic discussion and debate, but more importantly, you nail down a number, so we can really use this number for public policy making, budgeting, and strategizing our general direction in building herd immunity. So how then we can use this number to calculate, for example, and we have 6% of the population who are so resistant to this, how much this 6% will delay our achievement, the day that we will have 0 cases or really can go back to normalcy. So how, now let's talk about the implication first. Then now Dr. XYZ, and now you are in charge of the public health NHS, and how much you can use this number or these different profiles to apply your policy in helping the population achieve real herd immunity and also help with for example, resuming some services. It's simply like restaurants could be open, and airlines could be more could be safe to travel in, and also cross-border travel could be more relaxed now. Now, this is the substantive question. I want you to tell us what kind of applications these numbers could be used. Then I'll talk about the methods or technical part later. Yeah.
Yeah. Well,
Give us some suggestions.
Sure.
Yeah.
I mean, the worst of what we've heard from the United States in terms of political ads is so-called micro-targeting, right? That we now have understanding, let's say, of people on social media, people in certain areas of the world, and how to craft a campaign message. So people are getting very, very different political messages depending on what news they have, who they are friends with on Facebook and stuff. That's usually seen as a very bad thing and seen as sort of evil, right? And there was, Cambridge Analytica and all the sort of stories that came out of the last US election. This could actually be a very positive thing, because if you realize that, let's say, somebody in group 2 is much more receptive to a message that sort of says no, that really discusses herd immunity and stuff like that, and why it's important, whereas that might not be important to someone in group 3, right? And that's where the experimentation comes in. So I think when doctors look at this, medical scientists, they don't understand they think that a very technical or a very sort of literal message, scientific message will convince people. So, one of the things we've tested, and we wanted to make sure it wasn't turning people off, when people, when public health officials run vaccination campaigns, they often show a picture of somebody getting a needle in their arm.
Yeah.
And that's what vaccines are. They're telling the truth. They're not being, but that kind of disgusts people. People don't like breaking their skin, right? So there's this whole theory of disgust that we were saying, and who does this affect? Okay, what is going to, because these people right here, they're on edge, right? They can go either way, right? That's what the statistics are basically telling us, okay? They're not that happy that they don't want to put their kids in the front line, okay? How do you convince them that this is safe, and that's the big, and how do you convince them that it's necessary, that they can't just free ride? So I think what you can do is micro target, right? I mean, you can have messages that are specific to different groups of the population depending on what their hang-ups are. Rather than just have one public health message that might only be effective. And actually, the worst is if it's geared towards the people that are really intensely supportive anyway of vaccines, but it turns this middle group off, and that's what you have to worry about in sort of public health messaging, I think, now or forever. We just now have ways of solving the problem.
Yeah. You just actually, this is the way I want to ask the question. I also look forward to your answer in this way. Now, let me stop a little bit. And now while I'm asking my second question, please feel free to ask any questions about the method, about the policy implication. And please send a question. You can raise your hand, or you can type your question in the conversation box, or send a question to Dr. Pan and on the Taiwan side. Now, my next question is about dimensionality of this skepticism. So you may want to think about this like a spectrum. So you have now LPM is based on generally continuous indicators, but your questions are like a 5 points or 5-point scale, still treated as continuous. So we want to assume that this will be distributed with single mode. And now we think about this, what if they are doing it like a bimodal, or basically some questions is dividing into two portions, or you can see this like a polarization. But I saw your distribution, that those questions are generally single mode. And
They're
so in
skewed.
terms
Yeah.
of, yeah, skewed. And so if you look at this from the dimensionality point of view, for example, and this will cross the dimension of the conservative, liberal, and that 6% happens to fall within maybe the highly conservative, like some Tea Party in the U.S. case. Some portion of Tea Party supporters, they are also against vaccine too. So they see this dimensionality crossing. So you can add on to that. Indeed, you can narrow down to a smaller group. They're GOP or Trump supporter, and they're skeptics on vaccine. This is easy for micro targeting, but that could also complicate the matter, because could be mutually causing each other. We don't know which one causes it, and you are diehard Trump supporter, then you are entirely skeptical about the vaccine, or the other way. So if you do that,
You become
as you mentioned,
skeptical of
that we
vaccine.
do,
I mean,
yeah,
well, I mean,
then,
I think elite messaging matters, right? And
yeah,
this is
indeed, yeah.
also, I mean,
Mm-hmm.
you know, I was referring to specific messages, but this is basically what people were saying. Like, can Donald Trump just put on a mask, because that would have at least signal to his
No,
core
yeah.
group, right? People listen to,
Mm-hmm.
he's an opinion leader, like it or
Mm-hmm.
hate it, it just is,
Yeah,
right? I'm not passing
indeed.
value judgment on it.
Yeah.
And you know what you would need is people to step in and say, you know, if let's say, you know, I mean, one of the things I can do right now is to look. I know I have the data because these are on political surveys. Is I could say, well, are these people low trust, people with low
Mm-hmm.
political trust?
Uh-huh.
And what
Mm-hmm.
you would
Mm-hmm.
say then is the last thing you want is either Donald Trump, or in New York, people don't trust Governor Andrew,
Cuomo,
Cuomo,
yeah.
right?
Uh,
Right. So you don't want
yeah.
these people being your
Uh-huh.
messengers. You want Angela
Mm-hmm.
Jolie, or or maybe not. Maybe even the what you want is, who are the opinion leaders that you can turn to in the sort of center right or right wing,
Yeah.
right, that you can actually get to begin messaging. I think that's probably
Yeah.
just as important as the message itself.
Yeah. I want to say that not AOC, because it's already left, extreme left, and the saying is that something, that message. You're exactly right. This is how you cross the dimensions to make this more convincing. Indeed, so I think your research exposed to this finding, that now this is the finding now, but we may not know that what causes what. And if we can, for example, simply find out, okay, diehard Trump supporter or Tea Party, then we can promote, maybe invite the Tea Party representative to do that. That can be much more effective to talk to this population. Then then I think, on maybe on one hand, in some sense, it's like segregate this from other dimensions, other factors
Be
further
careful. Be careful of the
influencing this other to other
Be careful
group.
of the term dimensions, right? It's
Mm-hmm.
these are
Uh,
correlates, right?
mm-hmm.
So what a factor analysis does, we have a dimension of vaccine
Mm-hmm.
skepticism that we can break into
Uh-huh.
groups. Okay, and you're
Uh-huh.
right. These are like, is being a correlate. Let's not even get into causality. A correlate of being in this low vaccine thing group.
Mm-hmm.
Okay, let's say being, I don't know, on the political left or on the political right. Okay. And it is interesting because in the US, vaccine skepticism was kind of left wing for a long time. It dealt with, genetically modified food, all this stuff, organic, all this stuff that the left wanted. And then it kind of migrated to the right because of, other religion, other reasons, but the in a different world, and you can look at that world, right? Masks in the UK are nowhere near as political as wearing a mask in the United States is, and that's all because of rhetoric, right? The conservatives will put on masks here. It's not it's just a public health, sort of thing. So we haven't had that level. I think that's the challenge that the United States faces politically right now is everything is becoming, what color your bowling ball is basically becomes a political thing if the wrong person decides to opinion lead on it. So I think the US right now is, because it's so highly polarized, if you're going to make progress on vaccines, you're probably going to need the right people messaging to say, look, this is really important. Eventually, I mean, I think, states wanted to. We're seeing this happen in South Dakota now, right? In the U.S., right, where states that wanted to resist this, reality is reality, right? And I think that's the sort of challenge that areas of the U.S. are facing now.
Yeah. All right. I think this is also applicable in the Taiwan context too, and quite polarized. Also, everything is politicized to between the green and the blue camp. Maybe I can leave it. I can let the Taiwan side. Professor Pan, do you have any questions from the students and from your group?
Yep, you're on mute.
Let me see if I can unmute. Is this me or can we get you unmute?
Maybe I have that power now, huh?
Let me see. And yeah, I think you should unmute yourself. You could unmute yourself. Somehow I'm seeing you muted.
I'm going to give power back to you. How do I do that?
Oh, you mean the spotlight?
Hear me now?
Oh, there we are.
Yeah, please.
All right. Yeah, thank you. So I think the question is kind of related to what Tara just asked. Here I have a question. So Professor Scotto, could you extend the last part of your presentation about policy implications, such as the profile of the receptive or skeptic group of people? I mean, in a way, getting vaccinated or not could be a value-laden issue instead of being right or wrong, good or bad from an individual or micro level, which means that you want to get vaccinated or not. It could be it's my my freedom or my right to choose from the micro or personal perspective. So I think the question wants to know, how do you explain this from, even we know the different groups or different categories, different classes of people here, and in terms of the policy implications, can we extend the discussion to what should we do next? Even though we know that a certain group of people, they're skeptic, or the other group, they're receptive. And so what's next? So what should government do? Do they let's promote this or not to promote this? It's kind of a value-laden issue.
Well, I mean, in some ways with COVID, I mean, with the vaccine we're going to get to basically see, if I said I refuse my vaccine, the NHS will just go to the next person, right? Because the task, I think nobody understands that yes, there'll be a vaccine available, but vaccinating 60 million people, we actually need the military involved. They're mobilizing, they're passing laws to allow pharmacists to give injection, because it's just a huge, particularly if the one that passes has to be stored at -80. So some ways from a simple with this, it's going to take so long anyway that, the 40% that are super supportive of vaccines, you're going to want to, they're going to take up. Now, I mean, the UK is actually, the way they're going to actually ration this is they're going to do care homes first, because I don't know if you're following the news. We had a real problem in care homes where it basically spread, and that's where a lot of the deaths frankly happened from COVID. And then they're going to go down by 10 years, I think, until, so the idea that, you're going to have to worry about this 6%, that's only when we're actually trying to eradicate the disease entirely, I think. It's going to take a while. So some of this is, but if you really, really want to try to get to the point where you're not wasting a lot of money in your emergency rooms because someone decided not to get vaccinated, eventually you're going to have to get to that group, and I think that'll be through micro-targeting. I mean, we had a situation in Wales that, we had a measles outbreak in Wales because why people, read the vaccines causes autism and weren't vaccinating their kids, and the UK was just shocked by this. So there does need to be, messaging. I don't know if that's a good. I mean, I think it involves, trying to get the messaging. I mean, using the time we have now. I mean, I'm promoting my own research, right? To get the messaging right that's tailored to groups that may not be completely against vaccination, but may have concerns, and how do you allay their concerns? One of the challenges, if you read this literature on vaccination, is you can convince people, right? You give people factual information on vaccines. You can convince them that yes, vaccines are healthy, they're effective, but they won't change their intent, right? So you can change their minds, but changing their minds is one thing. What we haven't figured out is how do you get them to actually go to the doctor's office and take the vaccine. So we do have messaging that has been successful at convincing people that, okay, vaccines are not going to cause autism. They're not, but that still doesn't mean that they go to the doctor's office and get the vaccine. And that's one of the challenges that is hard for medical doctor and medical science to understand, because they don't deal with human behavior as much as we social scientists do.
And it's related issues about, now we're facing the COVID, which is serious pandemic situation right here. But before this happens, probably the issue about getting autism because of the vaccination or vaccine, people have been talking about that already. But the risk, I mean, people perceive the risk, this is if it is for other diseases or COVID, that weight is really different. That right now people are getting kind of grounded at home because they know what's dangerous out there. So the perception of the risk is different. And then
I mean
how do we do this using the same methods, or to get the same message?
Very might well be the correlates of some of these classes, because we do have this on the survey, is risk perception, is how people, I think this has been really challenging for medical science because, and public health officials, because getting people to stay home. COVID, has, is much more deadlier than the flu, but still well over 98% of people get over it, right? So you're really, but, so I think that, the enormity of public understanding of percentages and stuff is really hard, right? I mean, why are people afraid of going on airplanes when, stepping out into the street is far more dangerous, right? I think that I mean, but that's just the way. I mean, and I think the interesting thing is we're hearing things in public that we know as social scientists, right? What is 94% effective? Why did last week Pfizer announce early, right? I know because they had enough power on the statistical tests to get confident to release preliminary results. Because if you do, 40,000 people, you can detect an effect, if two groups split. But, you're asking people to, I think you're going to need, it's much more, I think, raw and rudimentary than that. It's about getting the right person to endorse a vaccine. Right. And we see this in the United States all the time. Sports stars endorsing, I don't know, some public health, right? It's, you don't involve politicians in this world because it's just too polarized. Right. So, in certain areas of the South where, college football is very big, and in Texas, college football and football is very big, right? Getting one of the college coaches to endorse vaccination is probably going to do far more than a Democratic politician, right? I mean, right? If you want to keep your messaging, online, you've got to.
So, Carl, may I add one more question here?
Yeah, please go ahead. Go ahead.
Here's a question. It reads like, the measures are essential because using a Latin factor is insightful, and the measures are essential, which means the validity of the survey questions is very important. Could you recap a little bit about how you came up with the survey items? Because there are 10 items, and so I think the student concerned about the validity and why this 10 questions can, so could you recap this?
Yeah, some of them came from an older scale that we wanted to retest basically and pull out for this. Others, like I said, we wanted to try to catch out people who were just randomly answering. So we wanted to have we reversed the wording of some, we reversed the ordering, although that built. We're also getting. There's a debate as to whether or not. I mean, I've simplified this a little bit for the presentation, of course, but is to whether or not you get people that agree, okay, that vaccines are effective and that it's great that the rest of the public, but it's not something I want to do, right? So that's actually moving into two dimensions, right? So some of the questions are subtly designed to tap that. I'm just looking. Recommended things. A lot of this is I am concerned about the serious side effects, right? You can get someone that agrees that vaccines are really good for society, right? It's sort of the egotropic versus the sociotropic, the idea that vaccines are good in general, but you know what? I don't like the side effects, so I'm not getting it, and I'll rely. It's to capture. So some of this was designed to capture the free rider problem, so to speak. We wanted to see. It doesn't look like it's coming through. It's a little early that that there's that type of stuff. So.
Thank you.
All right, great. I do not have any questions from my side, but I have a related one though. And do you think we can do some maybe robustness check, and or alternative, do an external validity check, and using these categorizations and from the latent profiles?
It's funny you should say that. Am I still sharing screen?
Yes, you're still sharing that screen, and with that output. Now,
so what
again, please be reminded, the output, all outputs available in the GitHub under two folders, CFA and LPA, LCA. Yeah.
So, in terms of external validity, so basically what I did was I saved these classes. My vaccine skeptic. Okay, that's my small. Okay, I've got my medium skeptic people, the ambivalent, the supportive, and the what I call the risk averse. That was a class we didn't really look at too much. in 2000, so these questions were asked on a wave that I asked in 2014, okay? And then we said in 2015, how likely, the exact question we asked was, how likely is it that you would choose to receive recommended vaccines for yourself and your family in the future? Okay, so that is what we would expect is if this scale has any, what you would say is external validity, we should see differences across the
现在
classes
你
in
的
vaccine
数据跑来
record.
跑去，根本来不及想。没关系。
Is that okay?
Go ahead. Go ahead. Yeah.
So what I did was I just did a very simple cross tabulation, and not surprisingly, those who were in my highly supportive class, the 30%, and we asked them how likely is it, they are also the most likely to say that they're the group that a year later was just were the most likely to say that they were. And if you look, these two skeptic groups were more likely to say, well, not at all. See the vaccine skeptics, they have the highest percentage of saying, well, no. Although what's surprising is some of them still say they're willing to get this, right? Which is probably good news, but we've got to explore that a bit more. But you could see the validity question kind of bearing itself out here, particularly because it's coming from different waves.
Yeah. All right, and great. Peter, do you have more questions from your side? 1 second, I think. Let me see. Make sure you're unmuted. Yes, please. Can you unmute yourself? Yeah.
Yeah. All right.
Yeah, good.
So here, I think it just stay on the screen. Here we have students ask about the TAP Taiwan class, and could you explain that a little bit?
Oh, I'm sorry. I called it Taiwan class because it's a class that I'm giving to Taiwanese students. That's why I'm sorry. The variable name is it's just a silly variable name that I gave to. So the Taiwan class, basically, remember the output that I showed from the M+. What I did was there's an option in the computer that I can save the classes that the profile it puts the respondents into. Okay, so like the computer, it put the respondents into these classes. Okay, now the cross tabulation is basically saying, okay, from 2014. You use something called the latent profile analysis to classify the respondents according to their levels of vaccine skepticism. In 2015, you re-interviewed these respondents, and basically you asked them, well, how likely this year are you going to go out and receive vaccines? Or are you going to get your vaccination? And what we're saying is we have some idea that this scale is working because those who were in the highly supportive group of vaccines in 2014 are also the most likely groups by a lot to say that they're extremely likely to get vaccines. Okay, so there's some validity, and those who are skeptic are also most likely to say, no, definitely not. I'm not getting vaccines. I'm not getting my vaccinations. Okay, so it's actually in some ways the skeptics are not as anti-vax in practice, and that's kind of what we're still a little confused about, people's knowledge and what people think of vaccines and their actual intent to vaccinate. So there's variation here, but it's in some ways it's not as large as I might have thought.
Right. And I read that the frequency is it's almost 4,000, right? The total?
Yeah.
2009, 917. And how did you get that sample?
It is a company we use called YouGov, their internet surveys.
I got it. Okay. Thank you.
And the nice thing is we survey people in the United States too, so we can actually compare the groups.
And what was the finding in general, comparing Taiwan and the US?
I'm sorry, the UK and the US, not Taiwan. We don't have a Taiwan sample, unless you want to do one for me.
We should. But they,
surprisingly, that there's actually very little difference in the overall level of skepticism. The extreme skeptics are larger in the United States, but they're not. It's not overwhelmingly large. But there are large groups of ambivalent people in both countries. Is really what we find, and I think, as news spreads globally, you get vaccine skeptics in Germany and stuff. So it's not. I don't think it's really linked to one country.
Well, according to a recent the news report, I mean, just these days, we're trying to use a newly developed vaccine for the COVID, and it says the news says that the reliability is about the safety for 95%. Probably there are 5%
effective.
people, will get some side effects or something. So that's about 5%, right? 95 versus 5. And here we have the skepticism is about 5 or 6%. So that's about, maybe this is,
Yeah.
I don't know if that's related. I don't know.
Yeah.
Just a thought.
Yeah. I mean, it's hard to extrapolate, but I see what you're saying.
Yeah. Mm-hmm.
Yeah. No more questions here. Carl, do you have any?
Yes, I think we do not have any on the outside neither, and I think that's just let me see if I have more questions on the side. No, and great. I think that we have a really great session, and we learned a lot, and you have a large sample size. I think this is something really interesting that's eye-opening for me. First time I see such a.
Well, I learned a lot
sample
too.
size.
I really like this idea, and I want to follow up with you. So let's talk more about this. I will talk to my boss and see if we can do anything on the Glasgow side. Thank you very much. It's nice meeting all your students and stuff, and have a nice day. I'm gonna have a nice nap now.
Yeah, I hope you have a good.
Thank you for staying up so late.
Okay.
Yeah. Anytime. Take care now. Bye-bye.
Thank you again, Tom. Thank you. Appreciate it. Yeah.
Bye-bye now.
All right. Yeah. Thank you all for coming to the Data Analytics Colloquium. Now, all the materials are already uploaded to the GitHub, and also please check back check back on the website dacolloquium.com, and we will have more event information loaded there. Now, bear in mind that next week, and we will take a break because of Thanksgiving here in the United States, and but we will resume in December. And Peter, will you talk about the December series?
The December that we're gonna have Professor Andrew Phillips from University of Colorado, Boulder, and then we're gonna have Professor Guy Wheaton from Texas A&M, and then we invited Professor Jeff Gill, which is a big shot. I hope that everybody can join us. And then we are going to post it on our deck, Data Analytics Colloquium website. Please stay tuned and be on time so we can enjoy the sessions provided and offered by these three professors. Thank you.
Thank you.
All right, thank you, Dr. Ho.
Yes, and I wish you a happy Thanksgiving, and from the U.S. side, and then we will see each other in December. Then we will have Dr. Phillips giving us a great talk, and the talk will be titled "Do Elites Really Have Financial Markets?" I think this is a lot of good data Dr. Phillips is going to show us. All right, I think I will wrap up here, and thank you very much, Dr. Pan, and say hi to the students and all the faculty members, and wish them a happy Thanksgiving. Yeah. Okay.
Thank you. Bye.
Thank you. Bye.
关掉。